I don't know.
All right, it's 10 o'clock. It is the appointed time for us to begin this week's Chamber Business Briefing call. My name is Don Williamson. I'm the 2020 Chairman of the Board of the CoronaChamber of Commerce. All week, our staff, Stephanie Shapiro and the rest of the office, has worked hard to put together the call today to make this a valuable tool for you and time well spent. We appreciate you joining in today, and we would like to first off thank our sponsor, Holstrom, Block and Park. Holstrom, Block and Park has a combined total of 300 years of family law experience. They specialize especially in family law, estate planning, and in divorce. So any of your needs that you have along those lines, they are a very renowned and reputable law office, and we would recommend them to you. If anyone on this call is interested in sponsoring this call, please contact the CoronaChamber of Commerce. As always, as we go through today's call and you have a question, please use the chat box at the conclusion of the speaker. Not everyone on the call will be able to see the chat box. People are also on Facebook with this call, so it's important that you use the chat box, and then if we have duplicate questions, Stephanie can filter those out so that we can again have the best use of our time. The CoronaChamber of Commerce has continued as just with this call being in operation every day to support our members, and among the things we do are this call, and you'll see some of the other events that we have at the end of the call that we'll talk about those. We also appreciate our speakers who bring in their expertise to this call, and today we have a really great lineup of people that are going to share with you today. First off is Aaron Hake, and I've been friends with Aaron for a while. He's very involved in our community. Currently, he is the External Affairs Director for the Riverside County Transport.
Johnny, I apologize. I don't believe Aaron is on as of yet. We're going to need to slide down.
Okay, we'll move on.
Wait just 1 second. Stephanie, would you interject and give who's on so that we can go right onto our agenda?
Yes, let's go ahead and have our healthcare update from Bob Blair.
All right.
Hi, guys. You ready for me to start?
Well, let me introduce you first, Bob.
All right.
Our speaker is Bob Blair. He's the Chief Administrative Officer for Kaiser Permanente, Riverside service area. He's responsible for the area's strategy, operations, and performance. The local media group is made up of over 675 physicians and over 2,500 staff, caring for a phenomenal 475,000 patients. He has a passion for diversity and inclusion and in mentoring and developing young leaders. He's been a big supporter of the CoronaChamber of Commerce, which we always appreciate, Bob. And at this time, I would like to turn it over to Bob Blair.
Thank you, sir. I appreciate it. And it's a pleasure to be with you guys. And I've got a few minutes. I'm going to waste one of my minutes just telling you how much I appreciate being affiliated and associated with this Chamber of Commerce and with the city of Corona. I love you guys. This is a wonderful organization, and it's just a pleasure and an honor to be here to address you all. One of the things I was sharing with Bobby this morning is I was gone last week in Seattle, so I missed the graduation for the executive leadership program, and I just heard rave reviews about how that was managed and handled, and my team and especially the lady from my organization, Francine Alexander, that graduated, was just absolutely blown away by the level of professionalism and organization that this chamber pulls together on an event like that. So I just want to congratulate the leaders of the chamber. You guys do an awesome job, and it's a pleasure to be with you. So I'll get right to it. Stephanie, can you, let's see if the slides work. If the slides don't work, they're not imperative, but we'll see if they work. There's a slide I wanted to share with you. Go ahead and click to the next one. This is one of the, click to the next one. I'm going to run through them. This is a dashboard. I'm not going to go through the data with you guys, but we have a Kaiser Permanente dashboard. This is the Riverside County COVID dashboard. And obviously I'm going to talk to you a little bit about COVID and the impact it's had. I'll try not to be redundant. Last time I talked with you guys, I talked a lot about how chaotic it was when we first got into this pandemic and how we ramped down all of our services, and we're worried about this huge upswing in COVID positive cases in our hospital. That actually didn't happen back when this all began, and it was eerily quiet. No one was coming to the hospital, no one was coming to the emergency department, and all of a sudden, you know, we started worrying about how do we ramp back up safely and take care of people safely. But this dashboard, and I'll talk, we've actually had some surge since then, and I'll talk about that a little bit. But when you look at this dashboard, there's a couple things that I think are really important that I want to point out to you. The county of Riverside has surpassed 50,000 cases, positive COVID cases. That's pretty significant. And our county, we're trending the right direction right now. For those of you who follow the kind of the news in the county, we have 224 patients with COVID in hospitals in Riverside County. It had been over 500 at one point. Our ICU volume of patients across the county right now is at 82. At its highest, it was at 177. The youngest person in our county to die from COVID-19 was a 27-year-old woman from Riverside, and the oldest, a woman from Corona who was 101 years old. I think what's important to be aware of relative to the county is for us to be taken off the state's watch list, they rate us. And our county has a rating currently of 9.5. We need to be at below 8 to be taken off that watch list. The number of cases per 100,000 residents needs to be 100 or lower. Currently in Riverside County, we are at 158 per 1,000. I think what I would say to you about, and depending, you know, unfortunately, I think sometimes this feels like a political issue, and it shouldn't be. We should talk about this factually and just talk about what's really going on. After the, you know, all of the holidays in late May, early July, the protests that went on, there was, I think there was a loosening. A lot of people came together for holidays, for family gatherings. We saw a huge, tremendous surge in our hospitals. And that's when we hit those high numbers I was referencing. And I just have to tell you, I mean, probably a month ago, we were at a point where we were in a bit of a panic, along with all of our colleagues in the hospitals, about how we were going to manage that patient volume in our ICUs. And as you guys know, I don't mean to instill fear, but I do want you to feel my reality of what it's like to see people in an ICU. They come in with difficulty breathing. So, you know, the vast majority of people get COVID, and they may be symptomatic. They stay home for 14 days, they get well. But we can't predict who's going to get really, really sick. And when people get sick, they start having difficulty breathing. They come into the hospital. They go on oxygen. We up their oxygen levels. We try all the newest, best medications and treatment options that are available. But despite all that, many people then go on to what we call BiPAP, where we push oxygen in, and then they sometimes go on a ventilator. And when they go on a ventilator, they're often on a ventilator for weeks or months. And I mean that literally. It's uncharacteristic to see people go on a ventilator and you can't get them off a ventilator for 8 weeks, and there's no visitors. It's a terrible thing to see happen, especially when somebody passes away. We told a wonderful story here today. We had a lady that's been on a vent for 8 weeks, and she came off the vent and she's getting well, and she's probably going to be discharged in the next few days. And we love those stories because typically when somebody gets on a ventilator, it's really difficult to save that person's life with this illness. So it's very serious. And so go to the next slide. I'll talk, I mean, I don't think the message has changed. And hit the next slide. I already did this one, Steph, as I was talking about. So what we've done to respond to this, and I think you're seeing this with our colleagues in the community, our other partners in health, is we've really ramped up alternative ways to get care. People are afraid to come in. People that need care, that need service, it's safe to come in. Our facilities are, I mean, we're cleaning public areas frequently. We're socially distancing people, meaning that we're making sure that we have chairs marked so that we don't have people too close to each other. We're doing pre-procedural testing. So anybody that's having surgery or anybody that's having any kind of a particularly invasive test is getting a COVID test 72 hours before that procedure, so we know they're negative. Same with patients that are having a baby. We test them before they deliver, or if they come in as an emergency, we test them in the moment and have a COVID result immediately to know if they're positive. So we believe that the environment is very safe, and yet people are reluctant to come in, and they're worried about coming into a hospital or a healthcare environment. So a lot of our care has shifted to virtual care. We're doing a lot of telephone visits, increasingly video visits, and patients. It's amazing to me to see the change in the world and how people are embracing video care and telephone care, who in the past really didn't embrace it. And that's both on the doctor side and the patient side. We've seen our visits on the telephone and video almost triple from what it was before this pandemic began. And we'll see where we end up. But definitely is going to change the way we deliver healthcare in this country forever, I think. The other thing is we've seen pharmacy change. Patients are driving up and we're bringing their pharmacy out to them. Mail order pharmacy has tripled in terms of how people are using mail order pharmacy. If you go online with our kp.org app and you order your pharmacy, it gets to your house within a day or two, and maybe 3. But it's very efficient. And so during the pandemic, when it first started and we ramped up, we got out to like 5 days. That was terrible. But now we're back to 2 days, 2.5 days, and people love that service, and it's really growing quickly. So I definitely think Bobby and I were talking about how innovative many of you are and how your businesses are thriving and how you're finding ways to survive and thrive despite this pandemic and the impact it's had on your businesses. And let me tell you, those of us in healthcare are feeling so badly for those of you that are struggling through this economic downturn. It's scary for us. I mean, we look at next year, we worry about the impact that this is going to have on employment. And so for us at this point, even though we're worried, we see the curves coming down, our ICU volumes are going down, our admissions are going down, but we're very concerned about flu that's coming. So switch to the next slide, Steph. I want to just briefly, and it's not a new message. If you look at this slide, please make sure that in your house, in your business, you're promoting hand washing. Have hand washing stuff everywhere in your, I think hand washing is probably the most important thing that can be going on in your businesses and in your homes. Is wash your hands frequently. Try to teach people not to touch their mouth, their nose. We do support and suggest that people wear masks. I'm not wearing a mask right now because I'm in my office and it's just me and you talking on the computer. But when I leave my office, I wear a mask. When I walk to my car, I wear a mask. Wearing a mask protects other people from you. It protects you from people that may be COVID positive. And it isn't well understood yet is, how small are the particles that infect someone with COVID-19? We do know that COVID is very infectious and that wearing masks has helped prevent that. And so we encourage people to wear masks. We require mask wearing in our facility. The third thing I would say is social distancing. And we know social distancing is effective and helps. And I assume for many of you, like for us, it has been a significant challenge for us to figure out how to socially distance people in waiting rooms that were not designed to socially distance people. So we have all kinds of innovative solutions coming on board. We've got I can't remember what it's called, but we're tapping into resources online where we can actually have patients go online, put in their information, and when they come in, we call them and say, hey, we're ready for you. And they don't even have to come wait in a waiting room. They can be in the car, they can be sitting outside, and they come up for their appointment. And so there's all kinds of innovative things going on to limit the numbers of people in waiting rooms. But I think the three big things are hand wash, social distance, and wear a mask. And I hope you're all supporting that, and in your businesses, you're practicing that. Because we definitely do worry that as we get into the flu season and into the winter, that there's tremendous risk still to see another surge like we did a month ago. And so we hope that we've kind of all learned about that, and we're going to kind of stay away from big groups of people, large gatherings of people, getting together without masks especially. And I would say, boy, washing hands is really important. The last thing I'll end on is flu. Flu season's coming up. We now have flu vaccine, and we've begun about a week ago to start giving flu vaccine to all of our members and our staff. Our goal would be to vaccinate 100% of our patients. Last year we got to 55% of our patients vaccinated. That's we have 520,000 people we take care of in Riverside County. 55% of those people got vaccinated. about 90% of our staff within the Kaiser Permanente organization, there's 7,000 staff that we have here, got vaccinated. So our doctors are almost 100% vaccination. So I really promote vaccination because I wish I could remember what my colleague, Dr. Neary, called it this morning, but he called it there's a new word out in the media where there's a lot of worry about if you get the flu and you get COVID, does that have a significant detrimental impact on your mortality? So, I mean, it makes sense for all of us to get the flu vaccine. I think you're going to see many of my competitors doing the same thing, my colleagues, my partners out there. We are, all of our flu vaccine is available drive up now. So in almost any of my buildings that offer flu vaccine, you'll be able to drive up and get your flu vaccine in the arm, in the window of your car. In some cases, it'll be drive up. Out in Coachella Valley, it's 110 degrees. And so the way they're doing it is people pull up, the nurses inside the building. It's impossible to keep a tent out there cool enough for somebody to be out in it all day. They run out and they do the vaccine and off the person goes. So please get your flu vaccine, encourage your staff. I call them your staff, your employees, to get vaccinated. It will really protect them. I had information here about, flu vaccines indicated for who, but, I would say, we encourage everybody to get the flu vaccine. I would say it's better to know if you're somebody that can't get the flu vaccine for some reason, who's at high risk. Young children, pregnant women, adults 65 and older, and people with chronic conditions. Definitely everybody I just mentioned should get the flu vaccine, and everyone else should get the flu vaccine as well. You're just not as at higher risk as the 4 groups I just mentioned. And I'll stop. Any questions?
Bob, thank you very much. Stephanie, do we have any questions?
Yes. Now that Hong Kong has started to see reinfection of COVID cases, are we expecting the same thing here? And if so, when do you predict it will hit us?
So it's interesting. I think what the issue there is if you had COVID, could you get COVID again? And I don't think we understand that yet. I certainly am not an expert that can tell you. There's a lot of opinions about that. What I will tell you is in the United States and in California, we're still in a situation where we've not acquired herd immunity, if you will. So even if COVID doesn't reoccur, let's assume that if you get COVID, you have some level of immunity for some period of time. We're not at a point where enough people have gotten infected that it is safe for us to feel like we have herd immunity. We really, what we're waiting for at Kaiser Permanente, and we're actively engaged in investing in opportunities to test vaccines. We hope that by early 2021, we'll have a vaccine that we can immediately make available to our patients. And that's probably what's really going to make us all feel better about COVID, once we can have a vaccine that actually is proven to prevent us from getting infected. But in terms of reinfection, the reason we're not too worried about that right now is because we're worried about everyone getting infected. So we've never taken our foot off the gas. We're still asking people to wear masks, socially distance, wash their hands. When I say that, I want you to know we're very concerned about the economy. We're very concerned about small business. As an organization and as an individual, I want to support my small business and I want to support business in California. I'm trying to, go out and get food and bring it home and buy things. And I want businesses to survive. I think we should all be doing everything we can to support our colleagues in the business industry, because this is a very, very difficult time. But I don't think we've ever taken our foot off the gas. Whereas in Hong Kong, they may have said, hey, there's no COVID, it's gone. Now we can kind of take a breath. And I think what they're starting to see is they're seeing cases in people that had COVID. And so the fear's out there that they need to step it back up. We've never taken our foot off the gas. So until we do that, it's not really an important issue. It becomes an important issue. Can we vaccinate? Can we prevent infection of COVID? And that's the question, right? Will we have a vaccine by early next year? I hope I answered your question.
Thank you, Bob. Stephanie, anything else?
No other questions at this time.
Bob,
sorry, guys, and I hope I kept to my time.
It was great. It was time well spent for us. So thank you so much. I know we know you're busy, and we appreciate your time very much.
Thank you, guys. Thanks for all you do. We appreciate you. Thanks.
Next, I'm going to introduce to you Aaron Hake, who is the External Affairs Director for the Riverside County Transportation Commission. He's been with the RCTC for almost 15 years. He's been a fixture of our local community. He's previously held the position of city treasurer for the city of Corona, and he's been on the planning commission. He's also a former member of the board of directors of the CoronaChamber of Commerce. He is a volunteer of so many projects in the Corona-Norco area, and I believe he is participating in one of the projects or one of the tests for a flu shot for the COVID. So at this time, I'd like to introduce to you my friend, Aaron Hake.
Well, thank you, Don. Thank you. You are my friend, and I am friends with many people here I see on this screen as well. I am happy to be in my hometown this morning. I grew up here in Corona, so it's always a delight to be able to work here as well. I'm excited to continue to share some news about how we also have not put lifted our foot off the gas pedal, as Mr. Blair made mention of with regards to what Kaiser is doing. RCTC has not lifted our foot off the gas pedal either with regard to our mission, in spite of some pretty significant challenges that we've had as well. And our hope is that the work that we're doing now will pay dividends now, but also in the long run in terms of Corona and Riverside County's economy with regard to transportation infrastructure. Before I get started on going into the details, I just want to acknowledge one of our commissioners from RCTC is here as well, and you'll be hearing from her probably about other issues. But Karen Spiegel, Supervisor Spiegel, is a former chair of RCTC and is your representative on RCTC. And we're very, very, very happy to have her support and leadership throughout the years to get a lot of things done here in the city of Corona. I also want to introduce David Knutson, who's on the line as well. You'll get to meet David more throughout the years, but he's our legislative affairs manager, and you may remember him from several years ago when he represented the governor's office of business and economic development down here in the Inland Empire under the Schwarzenegger administration. David was the Go Biz rep and has very close ties to the business community here throughout the Inland Empire, and is a great asset to RCTC as we advocate in the legislature and partner with local community groups like yourself. So let's get started. So right now, RCTC throughout Riverside County has 8 highway projects and a number of Metrolink station improvement projects that are continuing to move forward through the pandemic. We actually just finished some renovations at the North Main Corona Metrolink station, at the downtown Riverside station to help with accessibility for people with disabilities. And while ridership is low on Metrolink right now, we thought that was a good time to make some of these renovations to minimize the inconvenience to our passengers. And in the city of Corona, we have a number of highway construction projects that I'll talk about in just a minute. But just this week, we have kicked off a new interchange in the city of Paris to start the Mid-County Parkway project. That project has been decades in the making. And when you add everything together that we're doing right now, we estimate approximately 10,000 direct and indirect jobs are being created through the over $700 million of investment that we're making right now into the local economy. This has not slowed down because of the prudent fiscal stewardship of the RCTC board over the years. We've been very conservative in our budgeting. We know a lot of people want us to do more and do a lot of projects throughout the county. And we've done that, but we've also been very careful about how we plan for the future so that in situations like this, we don't have to stop. Another piece of good news for the taxpayer here is that construction bids are coming in low under the engineer's estimates. So over the last 3 contracts that we've put out onto the street, the estimates have been an average of 27% below our estimates, and we've saved $28 million. And that's money that we can then roll into future projects and get more done in the counties. We certainly know that there's a lot of traffic out there and a lot of problems we need to address. In the Corona area, we've got a lot going on. We're wrapping up the I-15 Express Lanes project that goes from State Route 60 down to Cajalco. We are anticipating that project could be ready to open for traffic by the end of this calendar year. I do want to mention something really important about this project that I encourage you to heed yourself and also share with your friends and neighbors. The pavement on this project is done. Those lanes look fresh and ready to drive on. Please do not drive on those lanes. They are marked off with orange cones. There are still crews working out there. And in fact, we've had some pretty serious accidents of people being reckless and irresponsible and endangering our workers. Please, please, please stay out of those lanes. I know they look tempting, especially when there's traffic, but we're launching a campaign called Don't Go There. So we strongly encourage you while we're finishing up to don't go there. As that project's finishing up, we're getting started on an exciting project at the 1591 interchange to build a new connector to the north. Many of you will know there's a connector to the south right now that goes from the 15 north to the 91 west and vice versa. Our friends in Norco and Harupa Valley and Eastvale would like a connector of their own as well. And thanks to the leadership of Assembly Member Cervantes and Senator Roth, we got funding to move that connector forward, and construction will start this fall on that project. We're also constructing a new westbound lane on the 91 between Green River Road and the 241. This project didn't exist a couple years ago. After we opened 991, we evaluated how things were working. We heard from citizens in your community and elected leaders like Supervisor Spiegel and Councilman Speak. And we worked with them to develop a brand new project that really went at light speed, that will start construction just in a matter of weeks, actually in October. And we'll be adding that westbound lane, hopefully help the backup that occurs at Green River in the mornings. The final project I'd like to talk to you about is the 7191 interchange. And this project has been on the books for decades. And we're trying to get the last piece of funding from the state of California. We've really struggled to get that last piece of funding to get it ready to go. We've got all the environmental work done. We've got the design done. We're getting the utilities relocated. It's ready to go, and we can get started if we get funding for this. So you'll be hearing more from RCTC in the coming months about advocating to get that funding so we can get this project ready to go, it is ready to go to get it moving. This will really help with the eastbound commute in the evening, and will help with folks getting on at Green River Road going eastbound. Last thing I'd like to mention to all the business members here today is that RCTC actually also operates a program called IE Commuter, where we partner with local businesses to help them help their employees find alternatives ways to commute to work. And obviously commuting has really changed in the last few months. We're launching a telework initiative, and we have a toolkit, we have resources, we can provide one-on-one attention to you and your business as you try to set up a telework program for your employees. There are a lot of considerations that go into having your employees work remotely. And I'm sure a lot of you have been through those challenges or might still be working through those challenges. I'd like to encourage you to reach out to RCTC so we can provide any assistance you may need. When folks use alternative commute methods, whether that's van pooling, carpooling, taking public transit, or teleworking, it's also helping reduce congestion on our freeways. And we certainly want to encourage that as much as we can, of course, while maintaining safety here in this environment that we're in here. So there's a number of ways you can stay connected. A lot of you know me, so you know how to find me probably. And if you don't, Bobby, Stephanie, or Dawn certainly can find me. But here's some contact information right here. Feel free to write it down, connect with us on social media. And I'd be happy to take any questions and do anything you'd like. So thanks for having me.
Thank you, Aaron. Do we have any questions for Aaron, Steph?
We do. Are funds from the toll lanes used for projects in the Corona area, or are they used throughout the whole county?
That's a great question. By law, the revenues from the 91 express lanes must stay in the 91 corridor. And in law right now, that's defined as between the county line and I-15. So yes, they stay in Corona. They don't have to stay on the freeway. They could go to the Metrolink station. They could go to any sort of improvements that help congestion through that area. And it will be the same with the I-15 project when that opens. So the I-15 corridor revenues from those toll lanes will have to stay in the I-15 corridor.
Okay, great. There's one more question here. I'm not exactly positive based on how it's worded, so you let me know if we need to reword. Okay, it says, wasn't the 91 project part of the original plan that was eliminated?
Okay, so many years ago, the original 91 project was much larger than what we built between 2013 and 2017. And the grand plan was to address many issues all at once with one comprehensive project. The Great Recession hit and our revenues took a hit like everybody. And we were still trying to figure out how to get that project out on time with the money that we would have available. And so we did select a few pieces of that project that we would defer. Not indefinitely, but that we would not make as part of the original project. So it was one of those things where we needed to be fiscally responsible and build what we could afford and what would provide the greatest benefit. Yeah. And so what you'll see over the next few years is we are going to be trying to get some of those deferred projects back in line. So that's what the 1591 interchange project is. That's what the 7191 project is. That's what that westbound lane is. There's still a couple other elements we'd like to see get done. So we're doing the best we can.
Cool. I know that the 15, as it's expanding on the toll lanes, it's going further south. And of course, now it's heading north as well once it completely opens. So they've adjusted where you can exit on the toll lane on the 15 going south. Mm-hmm. I think they're adding another exit within Corona. Is there any chance that they're going to be adjusting on the west side of Corona at all, where maybe you can get into it at Green River, or because right now you have to get on it in Orange County if you're heading eastbound?
Yeah, so the access points on the 91 won't change. Those are fixed.
Okay.
Yeah, we did do some restriping back when the project first opened to make that area smoother, but we won't be adding new access points. Okay.
That's all of the questions we have today.
Aaron, thank you so much for being here today. Everybody's always interested about our traffic flow, and we do appreciate you coming in and giving us your input. Thank you so much.
Thanks, Don.
Our next guest is Riverside County Supervisor Karen Spiegel. Her district covers Corona, Norco, Eastvale, Jurupa Valley, and the western half of Riverside, along with unincorporated communities of Coronita, El Cerrito, Home Gardens, and High Grove. It's a pleasure to see Karen, and welcome, Karen, and time is now yours.
Thank you. Some great areas that I normally cover have been covered, and thank you, Aaron, on transportation. That's been something I've been actively involved in for almost my full 20 years I've been involved. So thank you for answering those hard questions on the some of the projects. And then, of course, Bob Blair covered what we've all been focusing on, and that's COVID. We, just so you know, is that we bought 10 million masks, Riverside County. We've been distributing them all over the county. We want people to wear masks, and I know that you've heard masks are medicine. That has been something we've been pushing. Masks are critical. I know many people don't like them. They don't feel that you have some people who are a little bit skeptic about the whole COVID. Most of you know that Bobby and I are recovering, so we know that there is a legitimate virus out there. How we got it, questionable, who knows. Contact with somebody close to us, we know that. So there is ways to avoid getting it, and Bob went over there, so I don't want to duplicate the efforts. But there's some other things that are going on, and as of yesterday, we just introduced another new program. Those of you who aren't familiar with some of the programs that we still have our business assistance grants. We have our rental assistance. We have several programs for our homeless during this time. We have our nonprofits grants. And just a couple weeks ago, we started a youth community corps, and that's for 16 to 24-year-olds. It's a stipend program to participate in local programming so that they can kind of get some hands-on teaching, learning, and ability to take advantage of the opportunities that are going on during this time with COVID. So we're trying to get them ready for their next step, what's going to be happening with them. Now, as of yesterday, we started a new one called Pathways to Employment. It's for those 18 and over. It's a grant that's hopefully servicing about 500, and we're trying to make that so that it's about 100 per district. So each district in the county would have 100 openings, and it's a stipend, $20 per hour for $20 per hour. And they cover quite a few things in preparing. We're trying to get people back in line for employment. As many of you know, some businesses may not come back. Some businesses have already said they're not coming back. And so we have the opportunity to help retrain some folks, give them some contacts, give them some guidance and help. And so there's a program that will help them. So with a lot of our CARES funding, we are really trying to get into pockets in our community that we can see a difference, that we can help others as they make it through this pandemic, this unprecedented time that certainly is giving us a little bit run for our money. So, and I appreciate all of you who have been helping and reaching out. It's very, very important that we continue to be helping others. Just a real brief thing that you may have heard the governor, and it's been, I guess, a couple of papers. We submitted a proposed phased reopening plan. That plan was well received by the governor. He is reviewing it. It's not been approved. So if you've seen it floating around, it is a proposed plan and not approved. And with that, we had phases of opening. But I do understand the governor this week is going to be talking about his vision and what may be opening. We are still on the watch list. As much as we don't want to be, we are working very hard to get off that watch list because that's holding up our school waivers. Those of you who don't know is our schools are all virtual learning right now. We have some, particularly private schools, that are trying to take the opportunity to open. If you know of anybody, there's a press release out, there's videos out. I just made a video this morning. The school waiver program is only for TK through 6. The state still has not given the go-ahead for intermediate or high school. Everybody in intermediate, high school, and college are still all virtual learning. And we are just trying to get people prepared. There is an application online, rivco.org, public health, /coronavirus. And that gives you information from all areas that we're talking within the coronavirus. We want everybody to be successful. We want to get businesses up and running. So we are on the cutting edge of pushing the governor forward. We're hoping to see that, you know, things can make a turnaround. And with your help and your participation, let's get you going.
Thank you, Supervisor. Stephanie, do we have any questions for Supervisor Spiegel?
Yes, we have a few. There's 2 questions right now related to the grant. Do you know who a business owner can speak with regarding the grant? One of our members applied in the first round, but never heard anything.
Wow, wish they could have talked to me earlier. Rob Moran has been on these calls several times. Rob is the key person for those business assistance grants. And if you're having difficulty, I think you have the information, Stephanie.
Yes, I can get it to them. Thank you. Okay, next question relating to the grants. Is there any chance that this will expand again to include previously ineligible businesses, such as those in operation for less than a year?
You know, we are looking at how we can expand that because, you know, we've given opportunity to businesses, and if they haven't taken it, I know the other question is not only less than a year, that's a tough one. That's one that hasn't been brought up. That would be a Rob question to see if they're looking at expanding that. I did talk with Suzanne Holland. And the other one I discussed was some businesses with PPP. And the challenge is there's not a whole lot of money left in the business grant program. And if we open that up for those with PPP, we will probably be done with our money, because those are the bigger companies. And we can't say, well, you got this much PPP and this one. I asked that question because some of these smaller businesses had less than the $10,000 grant. And they said, well, what if we just got the difference between the 10,000 and what we got for PPP? And the way it's written is no PPP and 1 year. And those are pretty strong ones. Because if we gave money to businesses under a year, how the grant was written is they're not feeling that they're gonna have a strong enough if they're under a year.
Gotcha.
I fought for it. I said both of them. I wish we could, but but call Rob. Maybe he has an opportunity. So both of those, I would definitely refer him to Rob.
Okay, great. What about decisions for the nonprofit grants? When are those expected to be sent out?
They are working on them right now. You do know we have a separate organization that's the IE for the Hake Community Foundation. And so they're working on them. Michelle is working on those right now. And I will check and let you know, Stephanie. I think they're starting to go through them now because we just did the cutoff. And if there's any left, we'll do another round.
Got it. Okay, there's one last question in here. With the elections coming up in just 10 weeks and mail-in ballots and all the stuff going on with the post office, do you know what steps the Riverside County Registrar of Voters has put into place to ensure that everyone gets their ballots and that they're counted?
There are going to be over 100 locations for ballot boxes. Every city, the city clerk's office or somewhere, the city will have a box. The county has at the Register of Voters in Moreno Valley a box. And then there's going to be on election day several ballot boxes, because I do understand that some people don't want to mail them, but there will be ballot boxes around, and you can certainly take them the day of election also. There's going to be some early voting places. All these contracts have not been completed, so I don't know exactly the location, but every city will be having at least one, depending on population, and there could be more.
And when those are solidified, will there be a way for people to locate their closest ballot box, kind of like when they would locate where their polling location is?
Yes, once we get the list, it'll be published and everybody can look to see what's best, because there will be at least one in every city, but some cities will have more. So it's all about the numbers. For every 10,000, I think it is, maybe that's not correct. Maybe it's more than 10. I don't want to talk with, because you're catching me off. But Rebecca Spencer, who is our voter register officer, she will, she just did a press release. So I will try and get that also to you, and it goes to some of the details. And I know that Mr. Spiegel has talked to me about possibly getting her on one of these calls. So I'm working on seeing when she would be available so you can ask these questions directly to her.
Perfect, thank you. That is all the questions we have in the chat for you today.
Thank you.
Supervisor Spiegel, I know you're endlessly busy, so thank you so much for spending time with us. Great information, and we do appreciate it. Okay, moving on. One of the most important areas that we do at the CoronaChamber of Commerce is our legislative advocacy outreach. As everyone who's in business in California knows, it is a very tough task to stay up to date to what's going on at all levels of government. And that is why we have our Legislative Action Committee. And that's also why your membership to the CoronaChamber of Commerce is so important, so that we can keep you informed and be an advocate for business, not only locally, but within the state. And at this time, I'd like to introduce you to our chairman of the Legislative Action Committee. It's Anthony Edwards of Robertson Ready Mix. He's one of the Chamber's young professionals making history in 2020. So at this time, I turn it over to Anthony Edwards. Anthony. I see his picture.
It appears he may be frozen.
He may be frozen. So,
Oh no!
there we go.
Come back to us, Anthony.
Don. I want to thank everyone for being on the call. I also want to thank Karen for being on. And can you hear me now?
Yes.
Yes,
Can you hear me? Oh, I'm
I
back.
can.
Okay, good. Okay. Well, then in that case, I want to thank everyone for being on the call. I want to thank Karen for being on and being a constant, supporter for the county. And she's a key representative for Corona, but also, has the county's best interest at heart. And, obviously she's been constantly accessible, for any question. So thank you, Karen, for that. The chamber does a lot of legislative outreach, and I think it's really important to know what we do. And I think that's where a lot of these, how well they help the community is basically our goal, right? So one of our major supporters of that is Jeff Gibson, who works with, or is the owner of Occidental Communications, and he is our advocacy, or our chamber's advocate, and also he is our key historian. So Jeff, I'd like to drop this over to you.
Well, thank you, Anthony. So we are in the last 7 days of voting in the legislative session. So all of the good and bad ideas, mostly bad, that I've been sharing with you, many are up on the floor right now for voting. The committees have finished their work. So technically, or traditionally, that means that most amendments are completed, so that bills are kind of in their final form. As we've talked about this year, though, there were only a limited number of bills that were going to be considered because they all were supposed to have a nexus to either the COVID emergencies or with the emerging economic problems, and that were follow on to the state asking everyone to shut down for 7 months, rightly or wrongly. I'm not getting into that. Just there's an economic effect to that, and the legislature was considering it. So there are a number of major amendments that are still floating around on the floor, though, because the legislature limited itself. On 3 issues that we've been dealing with for you are workers' compensation, which we talked about last week. The 3 major bills that we talked about last week are up for voting in their respective houses. AB 196, which has not been amended. AB 667 has been amended, specifically just to be to COVID infection and dealing with a rebuttable presumption. So that's a fairly positive amendment. It's still a bill that we are opposing for obvious reasons. But AB 196 is one that we're following very closely, because that's the one that allows any COVID infection that occurs with anyone that can claim that they had a connection with your business, whether it's an employee or resident or a consumer or someone walking by on the street, can come in and say that they caught COVID from your operations, and then your workers' compensation would be hit for that. So that is up for a vote in the state Senate. It has not been amended. It just is floating out there. The second thing that we've talked about pretty substantially are tax increases. There was a $275 per head tax increase, AB 375. That's been killed, and it still is killed. So it's a little bit like the old Saturday Night Live joke of Generalissimo Francisco Franco is still dead. But in the legislature, nothing is ever really dead until the legislature is out of session. And so, as far as we know, the bill that was actually referred to as the job killer bill by other localities that have considered it and actually enacted it, believe it or not, there are people in this world that don't want jobs in their community, has been held up in committee and can only come back as an amendment. The second bill, AB 1253, which we went through, which is a 10 to 20% increase in income tax on, it's being billed as a millionaire's tax, but it also hits businesses depending upon how you have organized your operations corporately. That bill was heard in committee, a vote was not taken, and it is being held, from what we can tell, to be part of a larger budget discussion, which increasingly is looking like will occur in September.
The number you dialed has been changed.
Oh, I'm sorry to hear that. After, everybody can still hear me? Right?
Yes.
Right? Everybody can still hear me? So what it's becoming clear is that there will be in September, likely in September, and or after the election, there will be a special session to address the very real $54.3 billion budget deficit and the ongoing budget deficits of the next several years. So there's going to be a lot of activity that we normally would not see, but because of the crisis and the way the legislature's decided to organize itself. So AB 1253 right now, which is a major tax increase, is off to the side as well. So from that perspective, we're in pretty good condition. So those are the basic updates that we've got, and I'm happy to take any questions. But know that even though the legislature will be out on August 31st, that's their legal requirement to be adjourned, that it's very likely that we will be in September and October and later speaking to you, because there's an emerging economic issue, obviously through the loss of state revenue. The federal government has very clearly not going to be passing a fourth round of aid. The president, through executive order, has provided several different items of aid, including, as many of you know, the near permanent withholding of withholding taxes. So that becomes an immediate operational tax break for employees. Obviously, April 15th, 2021, everybody's going to have to pay, but for right now, they actually have some money in their pocket, and then additional unemployment assistance. So, but there likely will not be a fourth infrastructure bill, or whatever you want to call it, coming out of Congress before the election. So in any case, with that, I'd be happy to discuss whatever you need.
Thank you, Jeff. Stephanie, do we have any questions for Jeff?
No questions.
Jeff, thank you so much. And always appreciate having you on the call.
Thank you so much.
Okay, want to thank all of our guest speakers today. Each one of them did a great job and gave us a lot of good information. And we'd like to again thank our sponsor, Holstrom, Block and Park Attorneys at Law, specializing in family law, estate planning, and divorce. And next, before we adjourn, we have some brief announcements that I'm going to ask our chairman of the board-elect, who will be chairman next year for the CoronaChamber of Commerce, Kim Maybaum from Creative by Design, to help me to give you some announcements. Kim?
Thank you, Don. Just a reminder, Riverside County is offering $10,000 grants to qualified businesses. The deadline to apply is next Monday, August 31st at 5 p.m. Sign up at rivcobizhelp.org.
Today is a sad day. One of Corona's fallen heroes is coming home. Private First Class Brian J. Balteria, who unfortunately lost his life in a training accident off of Catalina Island recently, is going to be brought back here to Corona. We're going to line the streets to welcome him home today. He's going to come by the CoronaChamber of Commerce office on his way to Thomas Miller Mortuary right down the street. So please come down about 4 o'clock and let's line and show our respect for this young man who was serving his country and all of us. Kim?
Just a reminder to those of you who are not yet a member, or if you know of a neighboring business that would find chamber membership beneficial, please connect with Robert Yanez to become part of our chamber family. We do service a regional landscape. If you refer a member, you will get a free advertisement in the Corona Business News.
Our next Good Morning Corona will be on Friday, September 18th. And if you register by September 7th, you get $15 off admission. There's both virtual and in-person tickets available. We had a very successful Good Morning Corona last Friday, and we look forward to having you join us next month on September 18th.
Our next Coffee with an Entrepreneur will be with Greg and Bonnie Yoder from Crumbles Cookies on Monday, September 14th via Zoom. This monthly program is held in partnership with the City of Corona. It's free to attend, so register today. Past programs are available to watch on the Chamber's YouTube channel as well as Facebook.
We're going to have a restaurant recovery webinar on Tuesday, September 15th at 9 a.m. It's free to attend. We'll cover safety guidelines, financing and marketing, customer experience, and much more. It's co-hosted by the City of Corona, Inland Empire Small Business and Development Center, and the Riverside County Environmental Health Department. Share with a friend and register at mychamber.org.
Thank you to those businesses shown on the screen now for sponsoring the Corona Golf Classic, which will be held on Thursday, October 29th. Just a few sponsorships remain. If you don't have a foursome, don't worry. We'll invite frontline healthcare workers to golf with you and your team. Sponsorship is a great way to get your business recognized and build relationships and have fun. Opportunity tickets are also available now. Sales of these tickets allow us to include more of our local healthcare heroes. You'll get a chance to win some great prizes, including gift cards, a big screen smart TV, and a Fender guitar.
The Women's Leadership Conference will be on Thursday, September 24th. This is your last chance to get tickets at the discounted price of just $45. On August 31st, that deal will be over. The topics this year include preventing team burnout, speaking up for success, pivoting in the pandemic, and selling with a servant heart. We'll also have a physicians panel, and we're accepting anonymous questions at mychamber.org/WLC now. This is a 100% virtual conference. There's some fun new elements that's going to engage you. And this year you can purchase an exciting conference mystery box. You don't want to miss it.
Okay, register now for Paul Webb's very popular workshop coming up next Thursday, September 3rd. Paul is a licensed NLP master trainer with over 43 years of training experience. The focus will be on how to handle customer attitudes, skepticism, indifference, and objections. If you've missed any of the past workshops, don't worry, he'll do a quick review before going on to new material.
Join us next week, September 2nd. For this same call. Remember, you need to register every week so you can get the code and be able to join us on time. And if you would like to automatically be registered for every meeting, please email a request over to Stephanie@mychamber.org. Again, thank you to everyone for being on this call, especially to our guests and our sponsor, and we will talk to you next week. Thank you.